Hi, this is Garen Kirk with Pawhuska Chiropractic, and I wanted to talk to you today about Prolozone or Ozone Injection Therapy. First of all, what is it? Well, this is a therapy that can be used for pain. It could be pain in the muscle, could be pain in a joint. How does it work? What we do is we take a syringe filled with some vitamins, an anti-inflammatory that's plant-based, and we inject that into the joint or muscle wherever the pain is at. After that injection, we leave the needle in, change out the syringe, and put a syringe that's filled with ozone gas. We inject that into the joint. And at that point, there begins a cascade of reactions that are inflammatory. It's a process of where we're really just trying to trick the body into saying, hey, there's an issue here, there's pain here, you should really come in and fix this. And when that immune reaction happens and those immune cells rush in, that's what begins to bring about the healing process. Okay, so why did I choose to incorporate Prolozone into my office? It's very simple. Over the course of the time that I've been a chiropractor, I've been able to help a lot of people with chiropractic care, and yet there's a segment of the population that I just couldn't do anything for. I have a lot of patients that come in and they've got degenerative knees. They need knee replacement, hip replacement, or maybe they've got a shoulder that's got so much arthritis or damage in it that there's really nothing that I can do past trying to adjust or manipulate that joint. I wanted to be able to have something different, something that I could offer these patients that would be separate from sending them to the normal medical route, which is usually taking drugs or getting a steroid injection. And so what I found with ozone injection therapy, or Prolozone, is a therapy that I could use that was really simple, that got fast results, and that actually brought healing. It wasn't something we were trying to cover up with a medication or a drug. We were actually trying to heal the joint and fix whatever the pain was at a basic level. Okay, so now let me give you an idea of what happens once a patient arrives at our office and is going to go through and have their first shot for Prolozone. Of course, the patient will fill out some paperwork, and when all that's taken care of and we're ready, I'll take the patient back to my room where we do the injections, and I'll go through and do an exam on whatever area that is that we're concerned with. We'll clean and prep the area. I'll prepare the ozone and the needle and the syringes, and then we'll actually do the injection on the patient. When we're done, I'll escort the patient out to the front, give them care instructions, and then we'll schedule our next appointment. For most people, that's going to be 1 week after the first injection. Now, some people ask, how many injections is it going to take? It really depends on that particular person. I've had people who within one shot had a dramatic change, and that's all that we did for them. I've had some others that had some pretty severe issues going on, and we might do 2, 3, or 4 injections, usually a week apart, sometimes longer. But basically we're going through to see what the ceiling for that particular patient is in the healing process. We want to get them fixed as good as possible. And when we feel like we've reached that point, when the patient's happy with where they're at, then we'll stop and we'll let things go for a while and just see how the body reacts and how much better they can get. Okay, so now let's talk about what a patient might expect after receiving ozone injection therapy. The basic thing that I tell patients is that we're trying to cause this immune reaction. It's a hack. It's a way to trick the body into healing an area that it hasn't been healing. So because we're causing an inflammatory reaction, we will expect that joint or that area of the body to become a little tight, to become a little inflamed because of what we've done. Now that should be short term. They will probably notice that during the rest of the day. But when they get into that following day, we get 24 hours past that first injection, they're going to start to see a decrease in the overall inflammation in the area and the pain. And so I always tell patients that it's a two-part process. Immediate healing will come through that reduction in inflammation, and long-term will be that tightening of those overstretched and loose ligaments and tendons, a big influx in oxygen in the area into those tissues that are probably not receiving very much oxygen, the nerve regeneration, bone growth at the tips of those bones that have just been worn away. So we'll see something very immediate, a decrease in inflammation that will really bring some relief and a decrease of pain. But over the next weeks, the body will begin to heal itself in a little slower process, but will ultimately add to the overall healing that we're having for that patient. So who could Prolozone be recommended for? Frank Schallenberger, who in the United States is the main medical doctor, he coined the phrase Prolozone about 30 years ago when he first started doing it. He went to Germany, did some training, saw how they did things in Europe, and then brought that back to the United States. But Dr. Schallenberger does a lot of talks, and so constantly he was having people that would ask questions. You know, my uncle's got this, I have this, could Prolozone help with that? And so he finally condensed it down, and he just said, let me ask you a question. Do you have pain? Well, yeah, I have pain, and you know, I have this and that. Okay, does it hurt? Do you have pain? That's all you need to know. If you have a painful joint, if you have a painful muscle, a trigger point, if you've got discomfort in a joint, your spine, shoulder, knee, toe, wrist, carpal tunnel, anything, if there is pain, then Prolozone can help.